a mindfulness-based intervention program for reducing the adverse effects of childhood trauma. Presentation by Susan Reynolds. Introduction. The aim of the major report is to propose a mindfulness-based positive psychological intervention to help mitigate the negative effects of trauma associated with adverse childhood experiences. ACEs such as abuse and neglect are common in childhood and constitute as a major stressor with long-term adverse effects on mental and physical health-related outcomes. The purpose of the intervention is to help reduce the significant impact of trauma in children exposed to ACEs. Research has demonstrated success in mindfulness-based interventions for reducing negative outcomes such as PTSD, depression, and anxiety as a result from ACEs. Mindfulness interventions have further demonstrated enhanced coping, mood, and resilience responses in trauma-exposed children. Studies in children and adolescents also suggest that mindfulness interventions may improve long-term mental, behavioural, and physical health outcomes. Scope. This presentation will examine childhood trauma-related disorders such as PTSD and introduce a positive psychological, mindfulness-based intervention to mitigate the negative effects. Prevalence and effects of childhood trauma. The social issue chosen for this report is PTSD in response to childhood trauma. Trauma-related disorders such as PTSD are a common outcome for children exposed to traumatic events. ACEs such as physical, verbal, emotional, and sexual abuse and neglect all comprise of major stresses in children's lives and contribute to poor long-term physical and emotional health, behavioural, and social outcomes. Exposure to traumatic events is prevalent amongst children worldwide. Though data is limited in Australia to its exact prevalence, international studies suggest around 62 to 68% of young people will have experienced at least one traumatic event by the age of 17. Contributing factors and current treatments. Contributing factors to childhood trauma include abuse, neglect, caregiver mental illness or substance abuse, household dysfunction, exposure to chronic stress, and poverty. Childhood trauma-related illness can present as PTSD, depression, anxiety, or comorbidities. Current treatments for such disorders include dialectical behavioural therapy and psychodynamic therapy. Positive psychology, a mindfulness-based model. Mindfulness-based positive psychology. The benefits of mindfulness-based positive psychology include increased positivity, reduction in stress and anxiety responses and symptoms, increases in calmness, self-esteem, self-acceptance, self-regulation, impulse control and sleep quality, greater hope and self-awareness. Additional benefits of mindfulness interventions amongst vulnerable children include improved social and emotional competence and resilience. A mindfulness-based intervention for childhood trauma. Importantly, the practice of mindfulness helps to increase resilience and hope, which theory suggests to be vital mechanisms for children coping with adversity. Furthermore, mindfulness-based interventions have demonstrated success in treating PTSD amongst those exposed to ACEs. Thus, a high-quality, structured, mindfulness-based intervention integrating hope and resilience theories may help to mitigate the effects of trauma related to adverse childhood exposures, improving short and long-term health outcomes. The intervention. Pre-intervention. The intervention program will be aimed at at-risk school children where there are key indicators for identifying the at-risk child, including children already identified by the DHHS and socio-economic and parental psychopathology backgrounds. Given that teachers account for around 40% of referrals for mental health services, schools are well placed for identifying at-risk children for both placement and the delivery of such programs by student support services. Student support service officers would be fully trained to deliver this intervention. Program stages. The regular practice of mindfulness has been shown to significantly reduce trauma symptoms in children. A mindful approach to such symptoms includes emotional regulation strategies, relaxation techniques, and mindfulness and self-awareness strategies. The 8-week program will be delivered to at-risk children once per week in 1-hour sessions. Every session will include a form of mindful movement and a guided mindfulness practice. The program will be delivered in the following stages. Week 1, Introduction to Mindfulness, using the breath to help calm the body and mind. Week 2, Emotions, Thoughts and Mindfulness, explaining thoughts and normalizing anxiety and other negative emotions, how mindfulness can help to lessen worrying thoughts and emotions. Week 3, The Body, Brain and Emotions, teaching body sensations and how emotions affect the body. Body scan mindfulness practice. Week 4, Recognizing Thoughts, noticing unhelpful thoughts and self-talk. Week 5, Making friends with worrying thoughts, emotions and bodily sensations, understanding that these are here to help keep us safe. Week 6, Coping Strategies, effective problem-solving methods for anxiety, tense and relax mindfulness practice. Week 7, Finding peace and being in the moment, flow activities, mindfulness of feeling practice. Week 8, Wrap up and story time with the book, A Handful of Quiet, Happiness in 4 Pebbles. Activating positive memories and sharing of strategies learned. Here, children will also receive a gift of a meditation bracelet. Why this program? This intervention is based on evidence-based therapy and research from the Mindfulness-Based Stress Reduction Program, Mindfulness-Based Cognitive Therapy, Positive Psychology, and Acceptance and Commitment Therapy, which have demonstrated success in reducing symptoms associated with PTSD in children. Limitations. Limitations that may influence effectiveness of the intervention include school and social background and how the intervention is accepted within the school context. For example, if students are attending at their own volition or if it is deemed compulsory to attend. Some other limitations include the short duration of the program, which may impact its long-term effectiveness, and the training of support staff to the standard that is required to deliver a high-quality mindfulness program. The reference list.